We know that when you come off the medication, most of the weight comes back, if not all. In some people, in some cases, it's going to be even more.
The main problem with the GLP-1 inhibitors is that nobody knows exactly how they work. But if you question them, and indeed, if you look on a medical database like Hippocrates, that's the database most doctors look up drugs on, and look at the mechanism of action, it says unknown.
They reported that after 2 years, people regained more weight than they lost. Why the hell would anyone do that?
We like a quick fix, but in fact, the cost of the GLP-1s are going to bankrupt all of us, and it's going to make all of us a drug addict.
I think there's a lot of data that is concerning me about the type of weight loss that occurs with these medications, being disproportionately high amounts of lean tissue that's being lost.
There actually is a study going on, but you're not going to like, when I describe it to you, you're not going to like it.
GLP-1 drugs. What are your thoughts on those?
Yeah, well, obviously they are very popular right now, and they've been around for a number of years. They've been on the market for, about 15 years as a diabetic drug, and they've been helpful at reducing some of the glucose excursions. As a side effect, they started noticing weight loss, and so now they've been popularized as a weight loss drug in the form of things like Ozempic, Wegovy, Mounjaro, tirzepatide, and some of these other ones that are tirzepatide, I think, that are out there. And these GLP-1s are something called an incretin hormone. So we have these different incretin hormones in our gut, specifically GLP-1, GLP-2, GIP, and these drugs impact our satiety, our appetite, and then our gut mobility primarily in a way that we may get full early, or we may our appetite may be toned down a little bit. And we've heard for so many years, it's all about counting calories. But the problem is many people struggle with that because they're hungry. And it's like, well, I can't be hungry all the time. So satiety is a good mechanism with which to work in. Interestingly, GLP-1 is extremely potently stimulated by things like beef. We know that beef, there's literally studies on beef isolate and GLP-1 is a very potent agonist for release of that hormone. Now, the problem is that hormone is only supposed to last for a few minutes. I mean, it's supposed to be off and on really quick, like most of our hormones that are pulsatile. When you take a shot, it sits around in your system for days and days and maybe even weeks. So you have this constant on switch on something that's supposed to be on and off. It's kind of like if you got the house and the thermostat's on and it goes on and off when the temperature goes on, but you just flip it on and it's always running. It's always running. And the analogy I like to use is like when I exercise, after this podcast, I'm going to go out and run some sprints and stuff. My heart rate's going to go up. My breathing's going to go up. That's normal for that situation. But if I were to sit on the couch and take a pill or inject myself with a medicine that would make my heart go up and breathe hard, you would have some different effects, right? And so what we're seeing is in some cases, like I said, the GLP-1 is supposed to be on and off very quickly. Well, with the drug, it stays on for a long time. So this is why people are having this profound slowing of their gut, because one of the actions of a incretin hormone is to slow the digestion down so that nutrition can slowly make its way through the gut and it's not hurried through so you can fully extract the nutrition. But when you're doing that for foods like, cookies and candies and cakes, which are designed to typically be absorbed very rapidly and not slowed down, you start to have problems. And people are having things like gastroparesis, where if you go to have surgery and they're going to put you under anesthesia, you need to be off those drugs for, 3 or 4 weeks typically is what they tell people now, because they know this drug hangs around in the system for an awfully long time, or the effects are. And so how will that play out long-term? We don't really know. I mean, there's some longer-term studies on doses for diabetics, and there are some side effects and some negative symptoms, but we're seeing probably now people are taking it to lose 10 pounds. We have people, I'm going to go on Ozempic for 6 months and lose my 10 pounds. Those people, probably a lot of them are going to be harmed by this, and a lot of them are getting harmed. And we're seeing huge numbers of that. And the other thing is, we know that when you come off the medication, most of the weight comes back, if not all. In some cases, it's going to be even more. And so from the drug manufacturer standpoint, they're like, well, good. That means you got to stay on it the rest of your life. So ka-ching, ka-ching. This is a subscription model of medicine. We just keep, if you want to get fat again, come off the medicine. So you got to keep paying us our whatever it is, $1,000 a month, $1,200 a month for the rest of your life, which gets a little expensive, as you might imagine, for most people. I have certainly concerns about it. If you don't address the underlying lifestyle issues, they may lose some weight, but you're probably going to still see a lot of disease in that population. You're going to see Some of the benefits that come with weight loss, you may not see those as much, because what is causing someone to lose weight typically? Well, they stop eating garbage. They start eating the right foods. Maybe they're more active. If you don't do any of those things and you're still just eating garbage and not being active, but you're just relying on a drug, you probably most of the benefits you might otherwise see from weight loss are not going to come out. And in some cases, you might even be net negative long term, particularly if you come off the medicine. And now, like one of the concerns is the fat cells become hyperplastic instead of hypertrophic. And so hypertrophic cells just get bigger. Hyperplastic cells means there's more of them. And there's some evidence that they steer towards hyperplasia. So while your fat cells don't get bigger, they actually get smaller, but there's more of them. But then when you come off the drug, now you got more fat cells to deal with. And if those get big, now you're even, you got even more problems. So
Oh man.
so we'll see what the long-term effect is. I think there's going to be a lot of people that will regret those medications. And we'll probably see some of them in Rivera, most likely, I would imagine. There are a lot of, like we talked about there are a lot of startup companies that are popping up that are basically, I call them Pez dispensers for these drugs. I mean, they literally, I mean, you answer a couple questions and boom, your prescription's in the mail. I mean, it's like no questions asked, here's your drug. So it's just basically, it facilitates drugs, and they'll make a lot of money. They will make a lot of money, and they'll do well. And we're seeing those places pop up all over. A company called Row is one of them. You just want you want your drugs, sign up, you fill out a few questions, and they'll send it to you. Probably no questions asked or minimal questions asked. So I think for many of those people, it is kind of an unethical way to do that. I think if you are going to give somebody a medication, gosh, you better be on top of them. You better be making sure they're changing their lifestyle, because I think you can use it as a crutch, but I think for the vast majority of people that end up using this medication, it's going to be prescribed ineffectively. They're not going to change their lifestyle. They're not going to have the support that's needed. Because I got to tell you, I've been doing this for a long time. You need to support the hell out of these people. You need to support them on a daily basis if possible, for many of them. And that's why I literally have a meeting every single day, 7 days a week, 365 days a year, unless I'm on a plane. If I'm on a plane, they look down on you having meetings on planes. But I mean, other than that, I'm there and I'm having a meeting with my group and whoever shows up, and we're there to support each other. And you got to have that facility in place to be successful with this stuff long-term, irrespective of whether you use drugs or don't use drugs. I think failure to do that is, in my view, a real problem.
My next question is, I want to get your thoughts on GLP-1 drugs.
Well, there's several problems, and there's also some benefits as well. The main problem with the GLP-1 inhibitors is that nobody knows exactly how they work. Now, initially the researchers thought it works in the gut. Well, it turns out that there are GLP-1 receptors all over your body. There are many receptors in your brain, in your kidney, in other parts of your body. What are those receptors doing there? What's going to happen when you're taking these drugs for months or years to those receptors? And so a lot of doctors will say, well, this is how it works. But if you question them, and indeed, if you look on a medical database like Hippocrates, that's the database most doctors look up drugs on, and look at the mechanism of action, it says unknown. Okay. Now,
Wow.
that's number one. Now, these drugs have been around for about 18 years, initially just for type 2 diabetes, now for obesity as well. So we don't, and also the obesity dosages are much higher than the initial dosages were for type 2 diabetes. There is no long-term safety data. And, the average patient be like, wait a minute. You're saying there's no long-term study showing that this is actually safe for long-term use? 15, 20, 25, 30 years? Yep, that's right. There actually is a study going on, but you're not going to like, when I describe it to you, you're not going to like it. It's all the patients who are currently taking these drugs. And then whatever side effects they have, and then if they tell their doctor, and then if their doctor happens to report that to the side effect database, that's the long-term study. You as the patient taking the drug, you're actually the guinea pig in the study. And most people are not aware of that. I don't think that most doctors tell patients that, which I have a huge problem with, because I think people have a right to informed consent. And if a doctor has not told you, we have no idea how these things work. And we also have no idea if they're safe for 20 or 30 years or not. We literally don't know. If a doctor hasn't said that to a patient, then has that patient been allowed their right of informed consent? I don't think so.
Wow. So you said there's basically no randomized controlled trials with this at all?
Sure, short ones, yeah, but no long-term trials to see is this safe for 20 years, 25, 30
Okay.
years. Literally no trials to see if this is safe in children. And currently, the American Academy of Pediatrics is saying you can start these drugs as young as 12 years of age. While a child is still growing, still developing, their brain, where there are receptors, their brain is not even close to mature yet, still growing. You're and there's no long-term data showing that's safe, but yet that's now an active recommendation from the American Academy of Pediatrics. So uh, now the benefit of these drugs, if somebody says, "Look, I understand, Dr. Berry, proper human diet, blah blah blah, I get it, yeah, but I'm just not going to do that. I don't want to." In that case, yeah, I guess that's fine. If you literally have no interest in eating a proper human diet and improving your health by doing that effortlessly, then I guess take one of these drugs and hope for the best.
Wow. So that could be a potential benefit, I guess. But what are some of the downsides to this that you've heard of?
Well, we don't know yet, Adam. We're going to have to wait and see when this long-term safety trial that all the patients are the guinea pigs in,
Hmm.
5, 10, 15, 20 years from now, we'll be able to look back and say, oh, those drugs were a great benefit to humanity. Or, and then I'm kind of leaning towards the or. I think that it's going to end quite badly. I think once we start to see the long-term data, because we're already starting to see these drugs have a black box warning about thyroid cancer already, and it's rare, but it's there. It's
Hmm.
in a black box at the very top of the drug insert information. We're starting to hear cases of stomachs being paralyzed just forever. We're starting to hear cases of severe depression and suicide attempts. People just lose all interest in life, all interest in any food. They just don't care about any food, and that's not normal. That's not natural. We should enjoy our food and we should look forward to eating real food. But and so I predict it's going to end very badly. I hope I'm wrong. Honestly, I do. But I think that if anybody can adopt a proper human diet versus taking one of these drugs that are untested in the long term, I think that'd be your best bet.
Amen. Yeah, it sounds very irresponsible to prescribe something like that for sure.
Well, it depends on what your definition of irresponsible it is. If
True.
your definition is, oh, we want to make as much money as possible without actively killing people quickly, then this is a very responsible decision on the big pharma and the AMA, the ADA. They're all right in there with this. But if your goal is the long-term health optimization and not exposing your patient to unnecessary, unknown risks, then I would opine probably you should avoid these drugs.
What's your thoughts on GLP-1 drugs?
I mean, they're generally used in diabetes, and then they've sort of had a secondary use in weight loss, and I think that has been nothing but harmful. I mean, the studies for like things like Ozempic that showed like, wow, this makes people lose weight. The they reported that after 2 years, people regained more weight than they lost. Right. So like, why the hell would anyone do that? Like I saw that and I was just like, oh, well, there goes that. I guess that was, good try, but I guess that's not going to be used. I didn't think for a second anyone was going to be using this crap because they even said like, look, you gain more weight back 2 years after 2 years, you gain back more weight than you lost. Right. So why would anyone do that? And now it's sold out around the world. It's just crazy to me. And so, for doctors not knowing that and then prescribing it to their patients, I don't really understand that because it's going to hurt them long term. And that's what the data shows is that long term they're going to be worse off than when they started. So that's not good enough. That's not good practice. That's the proverbial deal with the devil, right? You think you're getting something all great and nice, but then there's always a catch, and the catch is always worse than what you got, and you end up really regretting the hell out of making that deal. You end up getting really, really screwed for that. And that's exactly what this is. you lose a bunch of weight, but here's the first catch. A lot of that is lean body mass. It's lean muscle mass and bone density. It's not just fat. You're losing healthy tissue. And you're giving this into middle-aged elderly people that are already, borderline issues with their bone density and sarcopenia. I mean, sarcopenia, which is just muscle wasting, is plaguing elderly populations and is a major killer. Your muscle density and muscle mass as an elderly person, that is directly correlated to longevity and quality of life. It's directly correlated. And so, you need to maintain your muscle mass and you need to maintain your bone density. And in fact, going on a carnivore diet, you can increase your bone density and your muscle mass. So as long as you're eating enough, a lot of people undereat. So make sure you're eating enough and enough fat too. And so, this is not good. You're losing weight that you don't want to lose. You can't afford to lose. And then after 2 years, you gain back more fat than the total weight that you lost, right? So you've lost bone, you've lost muscle, lost some fat. But now you regain more weight than you lost in total with all that lean body mass, and you don't gain back the lean body mass. You just gain back fat, right? That is a losing proposal. And that's not what anybody should do if they care about their patients and or care about themselves. One of the main things that people is reported, the main reason that people lose weight at all is because it makes them feel sick as hell. And so they're just so nauseous and so sick that they just lose their appetite. Now, some people it's more subtle, but they're just like, oh, I don't want to eat. They just lose their appetite, but there's just enough upset sort of feeling that maybe it's not just really bugging them too much, but it's enough to just kill their appetite. And so they just don't eat. But they're not getting healthy eating habits. They're not doing healthy things for themselves. They're not changing their behavior in any positive direction. In fact, they're getting worse because they don't feel like, oh, so they're just eating some chocolates every now and then, just to get by. And, oh yeah, I'll just have some. So they eat crap, right? They worsen their health. They worsen their eating habits, and they make themselves, they make them weaker and sicker as a result of this. And then after about 2 years, 6 months or 18 months to 2 years, the nausea tends to go away. And so that's why they regain the all that weight, is because it wasn't doing anything in the first place. All it was making them sick. And then so they just weren't eating, and then they were eating junk and they were eating crap, and they were losing bone density and muscle mass, and as well as fat. And now they have these horrible eating habits that they've built up over 2 years. And then they just they get their appetite back, and now they're just eating high octane garbage. And then they just slam back on all this weight because it also changes their biochemistry in a way. It's something that Professor Ben Bickman, who's a professor of biochemistry and metabolism over at BYU, so this is exactly what he does. He said that taking Ozempic actually primes the metabolism, primes the fat cells to actually put on a lot of weight and just grow real big. So now you have these poor eating habits. Your appetite comes back. You're metabolically primed to just balloon up, and then you just now you just have this perfect storm of the situation that will make you now put on massive amounts of weight. So I think it's probably one of the worst things we've come up with in in recent history. It didn't make sense to me why anyone would prescribe this, and certainly not volunteer for this, when they said themselves that you gain more weight than you lost after 2 years. Like, what are we doing? It's like, these 2 years, this is just all I need. It's just like, really? I mean, if it's just like, this is like, oh, look, I'm getting married next year and I'm losing 50 pounds, and so it's like, that's the only situation that you could say, like, all right, you know what? I wouldn't do it. I wouldn't recommend it, but at least you're being realistic about it. You want this day to be thin, and then after that you'll deal with it, because that's what you're doing. You get those 2 years, and then after that you're dealing with it. And the thing is too, is that even using the Ozempics and things like that for diabetes, like, it's not necessary anymore. You just put them on a ketogenic diet and it just goes away. You don't have to treat this. You don't have to manage it anymore. You can cure it. And what doctor who's worth the name doesn't want to cure diseases? There's no good option there on why people are getting Ozempic. I think there's a fault and a breakdown in the system somewhere in there. Otherwise, that wouldn't be out there and at the levels and the rates that they are now.
What are your thoughts on GLP-1 drugs?
They're a wonder drug. They're going to make a few people a lot of money and a lot of people drug addicts. And that's the sad part to the story. We're all suffering from obesity and the diseases which come along with obesity. But what if obesity wasn't a disease? What if being obese and fat was actually a normal human trait to survive migration, the famines, gestation, hibernation? Might it be that we've got it all wrong? And so the problem is that we're encouraging people to eat 3 to 6 meals a day when the caloric intake they need is less than 1. And then to get on a treadmill and burn the calories that they spent the money to eat, which causes the diseases, which then requires the doctors and the drugs and the dissections, which have also side effects. And if you think about our failure in helping people be non-obese, we've actually created the beast. 3 to 6 fruit, fiber, vegetable, seeds, and nut meals a day. And exercise, which more people exercise today than ever before. The last I looked, we're more obese than ever before. We have more cancer, stroke, hypertension, diabetes than anything ever before. But this is another really sort of good, quick one. What if we're all being damaged by the healthy plants we eat and nothing more? Because plants are the predators and you and I are the prey. And so these drugs initially all came from plants, herbal medicine, and we like the drugs. We like a quick fix. But in fact, the cost of the GLP-1s are going to bankrupt all of us. And it's going to make all of us a drug addict. And that's the sad part, because then there are going to be many other side effects that we're going to see way down the line. And we're going to be like, how did we ever do that? And when you think about the gastric surgical procedures to help people be skinny, had they just gone to the proper human diet, as our good friend Ken Berry had coined, PhD, eat the meat, be the master, eat the mush, be weak and meek, and ultimately slaves, soldiers, peasants, and prisoners are domesticated animals, and they are fed plants. But the masters at top eat the meat, which keeps them the masters. And they tell all of us to eat the mush, don't eat the meat, which then causes the diseases that get blamed on obesity. But if you're fat in a famine, you're the only one surviving. Everyone else dies.
Right.
Adipose tissue contains every mineral, every vitamin, every micro and macronutrient your body needs. Obesity is not the cause of any disease. It's the poisons from the plants and the microbes in your gut that go to every nook and cranny of your body. That you try hard as can be to get skinny, thinking that, well, if I'm skinny, I won't get the diseases. And yet you do anyway. And so the GLP-1 drugs are like master inventions because we want a quick fix that is actually not, because it's like heroin, cocaine, nicotine, caffeine. These are all plant toxins that we become addicted to, that we will do anything for. And you know, I'm not going to turn away the GLP-1s completely for so many people. There may be a reason for it right now, And part of that is getting people to change their dietary habits is hard. And so maybe if we can help them get a little bit down and we can at the same time help them in the nutritional side, it's going to be a game changer. But it's still at a cost of side effects and the cost of the drug. And that maybe many of those people are going to have side effects that we're like, oh, gee, had they just ate steak and nothing else, they would have been fine. So, it's the razor's edge. And especially as a Western trained doctor who practices full-time Western medicine, by the way, I will still utilize some of these things because my patients ask for them. Or we're like, you know what? This person's, we've thrown keto at them and carnivore at them, and they just haven't gone there. So I want to be a little bit always open to all sides, even the gastric bypasses for those people that try and try and try and try, because the way we treat obesity is criminal. We judge people based on their size or shape as criminals.
Mm-hmm.
And whatever body you're carrying around is a beautiful, amazing body by God. And so when we can realize that, and I imagine I was talking to a patient yesterday, and she weighs, 260 pounds. And actually, I think she was a little more than that, but take 260 pounds. And I'm about 160 pounds. And if you gave me 100-pound weight to carry around all day, could you do that? I couldn't. No. But this woman carries around 260 pounds and goes to work and does things and is productive in life. Is she sick? And is she weak? And are her muscles strong? You better believe they are.
Mm-hmm.
And I tell people all day long, I'm going at that little tangent, aren't I?
I love it.
Muscle weakness only happens and wasting from non-use. Interesting, when a bear hibernates for 6 months, it loses no muscle mass and no bone mass. It loses only adipose tissue, and yet it builds a baby bear. Where did the building blocks of that baby bear come from?
The fat.
The fat. So your adipose tissue is the building blocks of the repair of your cells and new cells and a baby. There's nothing wrong with adipose tissue. Obesity, visceral fat, subcutaneous fat does not cause disease. Now, we may use it as a sign of disease. You're obese, you likely have the precursors of diabetes, hypertension, depression, anxiety, all these diseases that are like growing and growing and growing and growing and bankrupting us also. GLP-1s are going to bankrupt us. And as a business owner, our health insurance for our employees went up $2 million in 2 years. It was about to go up another $3 million and bankrupt us. I had to change it completely. And unfortunately, we had to even lower the plan, because if everyone wants access to whatever healthcare puts out there, we're all going to be bankrupt.
Goodness.
So in truth and reality, we're simply poisoned by plants and protein, by the way, because look up protein poisoning, look up plant poisoning, and a low-fat diet. That's the deadliest thing we do. We're searching for the right diet guru, the right menu, the right surgical procedure, the right pill, and now the right shot. And yet we hold in our hearts something that is so amazing that takes us back to our origins as human beings, where we came out of the trees not to eat the grass, but to eat the grass eaters. We are through and through hunters, and we're really good at it. We're too good at it. Basically, we probably decimated the majority of the animals out there, and that the only thing we could eat is grass and grains. And eventually we figured out, wow, we can manipulate this and we could be happy. But it took a lot of slaves, soldiers, peasants, and prisoners to make that truth and reality, which is sad for the majority of human beings.
Do you have any experience with GLP-1 drugs? And what are your thoughts on those things like Ozempic?
Yeah, I have not prescribe these drugs for any of my patients. I've had a few patients come to me on the drugs, and we've worked on getting them off of that. Again, I don't think these are good long-term solutions. They may have some usefulness as a short-term kind of bridge while people are making changes in their habits and lifestyle. And that's the only place that I can see a role for them. Otherwise, I think there's a lot of data that is concerning me about the type of weight loss that occurs with these medications, being primarily or being disproportionately high amounts of lean tissue that's being lost. And that's going to set people up to be in a worse metabolic space long term. The weight regain that occurs when you come off of these medications, and even we're seeing when people stay on them for long periods of time, they seem to lose their effectiveness. And then, of course, like any medication, there are side effects. And so I don't view these medications as a viable long-term solution to the weight problem. I can accept that there might be a role for them short term in conjunction with good metabolic focused diet and lifestyle changes. And I know a few of my fellow practitioners in this metabolic health world that are using them in that way. And I can grudgingly accept that, I guess I'll say, but I don't think they're necessary. I think low carbohydrate diets are very effective on their own, don't really need the medications. And that's still my preferred approach.